Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department, doing our weekly COVID-19 update. Today is November 13th, 2020. The Falmouth Health Department's website is, the town's website is falmouthmass.us. The email for the Health Department's health@falmouthma.gov, and our phone number is 508-495-7485. So as of today, there's been 325 cases of COVID since the beginning. Sorry, the second bullet point I did forget to, I was rushing to get this done today. It's been about 25 cases over the last 14 days, which would be the last 2 weeks, not counting this week, which was a half week. So a half week meaning that the state takes the previous 2 full weeks when they do the data, and I think the number is like 25. About 92% of the cases are no longer in isolation. That number goes down as more cases pop up because we have had an increase in cases. If you notice, we were 309 last Friday when I did this. We're about 14.7% of all cases in Barnstable, with around 14% to be expected. And we continue, of course, to do the contact tracing through the VNA and the state CTC. If you look at the daily, this is our weekly case trend, which shows each blue dot represents how many cases we had in a particular week. The far right represents the last 3 weeks, and of course you can see that it's no longer like it was between May and sometime mid-October. So we've had our increase. The state as well has had an increase, and we're starting to see it, though we are not seeing it quite at this point like it was elsewhere in the state. If you look at this is our all new cases since the beginning. You can see where, in early May, or late March, early May, you see it really going up hard fast. And you see a couple of incidences here and there where it does, but mostly it's been sort of on the same trajectory. But now you start seeing the last couple of weeks with an upward swing, which is indicative of what's happening at the state. The state changed the color coding. Gray means less than 10 cases for Falmouth. Green will be less than 43 cases. Yellow would be greater than 43 cases or a 5% positivity rate. And red would be greater than 43 cases and 5% positivity rate or higher for the 2-week span. Okay, the old method was 5, 17, and 35 without using percent positivity, which means that we had 19 cases the previous week. We would have been in the yellow right now, not in the green, under the old method. The new method, we are in the green. And so the state changed it mainly because I think a lot of towns would be red and yellow under that tighter metric, and they've changed it around. So here is the weekly dashboard that comes out for each town. Comes out now on Thursdays. You can see how we've sort of progressed through this with the number of cases: 10, 12, 12, 11, 15. So right around that under 1 to 1 case per day average. And then the last 2 weeks we've been on a 1.5 to almost 2 cases per day average. Positivities was around in the 2 per 100,000. We're now in the 4 to 5 range. So we are on a higher trajectory, but not at a trajectory as high as what other towns are seeing. Our positivity is got at it's 1%. It had been for the last couple of months below 1. After 2%, it's considered community spread. The likelihood of things spreading, getting out of control. So we're heading in the wrong direction, but we're not at a point where we've gotten to 2%. Barnstable County, on the other hand, has had 213 cases over that same time frame, with a daily incidence rate of 7 per 100,000 and a positivity rate just under 2 at 1.88. So they're getting close to that too. The state is over 2 at 2.29 for the same 14 days with 20 per 100,000. Falmouth testing frequency is really good still. We're averaging the last 2, so basically the month of November, since about Halloween, we've been averaging at least 1,200 tests, or right around 1,200 tests per week, now closer to 1,300, around in that area. So it's a robust amount of testing, which is good. It does tend to find milder cases that we may not have found earlier, and I'll show you that in a further chart. Barnstable County, you can see the counts by day since the beginning, way back in March. The far right, the green, shows where we are now. I put a dotted orange line to show that we're kind of where we were in May in terms of case numbers on the county. There's been a couple of clusters mid-Cape that have been a good chunk of that. So that 20, 30, 13, we had 8 yesterday, so it was a good day yesterday. but we've been in that 20s and 30s up to 41 one particular day, which kind of mimics where we were in that late April and May, early May timeframe. Now, back in early May and so forth, we weren't testing as many people. We were only testing more symptomatic people. So we were probably missing. So a lot of the cases that are here in the far right, the more recent ones, will have a tendency to be tend to be more milder. That's why you're not seeing as many cases in the hospital. Hospitalizations are up, but not necessarily here on the Cape. So here's the daily counts. You can see that Middlesex County is not doing well. Suffolk, Essex, Bristol, they're all having high counts. We've been, again, between 8 and 30, usually, typically. State's dashboard that's up daily tells you the daily cases. We're now in that 2,400, where a week or two ago I was telling you we're around 1,000 to 1,200. Once that positivity gets over 2, those numbers tend to jump. If you look at cases, they've been mainly in the below 50 age, the vast majority of cases. There've been about 21 recorded deaths for the day. It's about where we've been, right around that 20. So again, not going in the right direction. So this chart here is I call a rainbow chart. This shows you from the beginning, the far left, the people that are in the people that fall in the yellow and red were more of the cases back in April. That's over the age of 70. The young under the age of 30 would have been in this dark blue, light blue, and you can see where it shifted over. As we do more testing, and we're testing people that are more mild, we're testing more younger people, finding that it's more in the younger person's population. We seem to be doing a better job with the elderly, those over 70, which is good, and that's why the hospitals aren't at a point where they were earlier in the year, back in that sort of April, May, late March to early May. All the metrics here are not in the good direction. Our 7-day average of confirmed cases is up at 879. All right, well, lowest observed value being 157, so about almost 10-fold higher rates than we had, let's say, a month and a half ago. Positivity is up around 2.9. So of course, anything over 2 is bad. You want to be under 1 was good. And as it was under 1, you didn't see the cases popping up so fast and going as hard. So as you get closer to 2, then when you're over 2 is that magic number. Patients in the hospital, that number is increasing. We're closer to 600 when we were in that sort of low 3s in early October. And the deaths have been staying between the teens. Now we're in the low 20s. That hasn't gone up as high because, again, a lot of the cases are being the younger group age. Cases since the beginning of March. This one here, you show May, and we see our next wave, so to speak. Now, these 2 waves are a little bit different. If you had as much testing that was being done, let me go back. We did 98,000 tests in that one day. By mid-April, we probably only had maybe 150 total thousand tests done. So we're testing so much more. This peak, if we were testing at the same rate we're testing today, would be off way above the paper here, way above the slide. We were just catching symptomatic people. Now we're catching with routine testing of healthcare workers and college kids and anybody who wants a test can easily get one. That this number, because we're doing so much more testing, this number is more accurate to what actually is out there in the environment. This was very inaccurate early in May because we just weren't testing enough people. We didn't have enough tests. It was a little hard to get tests, usually based on symptoms. So this number, even though this shows that it's getting closer to what it was in May, I think what May was just underreported. Percent positivity is, like I said, 2.9, but that includes all tests. The bottom that shows 0.27, that is higher education only. If you adjust away the higher education routine test of healthy people, your test is closer to 5% positivity, which is really high. So we're heading, and once you get to that 2, you'll notice that the graph sort of goes up. You start getting a much more rapid growth, much more higher, much more cases as you get above 2%. Hospitalizations, I'm sorry, I didn't put the Cape Cod Hospital in here. I missed to do that. I think there's 1 or 2, but none in the ICU the last time I checked. I think there was 1 at Cape Cod Hospital, none in the ICU. So that's not accurate. If that was accurate from last week, I apologize. We're up 163 per average daily hospitalization from last week. So the hospitalizations are up, which means that's catching some of that age group that's over 50 generally, over 75, over 65 for the most part, I would think. But, you do have an increase every day in the number of cases. We haven't had a drop since early November, and that was only the 4. So you see much more pluses than you do minuses. ICU is now 151, and intubated is 68. Okay, so it does show that that's not jumping quite as much, which might mean we're just better at treating it, and I hope so. Daily hospitalizations, you can see that chart's not going up as much as the number of cases, so it shows that we're a younger population. We're catching more milder symptoms in our cases, so we're catching more cases, of course, than we did before. And our hospitalizations are on the increase, but not at the same sort of what it was with the number of cases. Total hospitalizations, long-term care facilities, last week, the November 5th data had 64 in deaths. We're at about, looks like 70 or so higher, at 6538. More than that, yeah. So we're somewhere, that's where some of the deaths are coming from with our daily deaths. Still about 2/3, 2 out of every 30 deaths were associated with long-term care. Our nursing facilities listed long-term care facilities are still doing well, and hope it continues. So COVID testing is still the same right now. Have Falmouth Hospital by appointment. The physician would call the Cape Cod Dedicated Call Center. You can still get it at Community Health Center of Cape Cod, Convenient MD, the walk-in clinics, East Falmouth CBS, and other places. If you go on mass.gov, COVID-19 testing, and that's for the PCR test. All of them will give you the PCR rapid test method. The PCR test that goes out to the lab. That's the confirmed confirmed test. So PCR test is what you're looking for confirmed. All the numbers I have given you is based on confirmed PCR tests. It does take about, right now the states, I think the number was, if you go way back, it was like a day and a half to a little under 2 days for an average for a turnaround on tests. But they're very, very, very accurate. Antigen tests are less so, but it is rapid, and DPH considers it probable. And antibodies, I haven't been seeing too much about antibodies to just detect a past infection. You're seeing more antigen and PCR, and we're real close. Some doctors' offices and so forth are working towards getting rapid test PCR, which is the goal. So with all the increases in cases throughout the state, last week started on Friday, that we've got 3 new governor orders. Order 53 is basically businesses such as bars and restaurants. Not bars, you can't have them open, but restaurants would be closing at 9:30, and other entities. Okay, no alcohol served between 9:30 and 5. If you're a convenience store that also sells alcohol, you can stay open, but you wouldn't be able to sell alcohol. Order 54 is changed the capacities to 10 indoor, 25 outdoor at a household. A venue would be 25 indoor, 100 outdoor, and lower risk, 50, and higher risk. We would be considered lower risk, so public venues would be limited to 100. Unless they already have specific guidance. So if you're already a restaurant, your capacity is not limited by this because you have your own guidance for restaurants. It would be based on separation and social distancing, not on a particular number. Section, so it also requires that anybody report positive cases and cooperate with contact tracing, could be subject to penalties. So if you have a indoor gathering that results in cases, you could be fined if you're not going to share the information. Getting information sometimes is difficult from certain patients who do have it through the contact tracing. And Order 55 requires a mask at all times in public, whether indoor or outdoor, regardless of social distancing. So everybody is required now to wear a mask when they're not at home, and also when they're not in the car. But other than that, when you're out walking around and so forth, the governor wants you to wear a mask. Okay. So social distancing doesn't change. I've had this slide up for a while. It's continued diligence. It's more important as ever. Hand washing, hand sanitizing, having good masks, quarantine upon arrival when you're traveling. Next week I'll put in some information regarding Thanksgiving. Thanksgiving's could be a problem as we travel and we meet and we go to places that we wouldn't normally go to meet relatives and friends and so forth. There's going to be a mixing of people, and a mixing of people generally results in more cases. So we have to think about that as our travel plans and so forth for the holidays. So most of these cases that we find can be traced to within households. So we find that households, so one person gets in the household, you end up with probably 2. And so if there's 5 households, there's 10 cases. We do also find that people have gone to weddings, gone to gatherings, gone to parties, gone to different indoor things, and cases have occurred from that. So you want to minimize your risk by not doing that, going out to places wearing masks, staying social distancing only when you need to. Also staying at home when ill, even mildly ill. It's easy to get a test. If you're under the age of 30, it could be a very, very mild symptoms, okay? So that's where you have to really be diligent about it. And also you want to follow the state guidance. Of course, last thing we want to do is undo the hard work. We haven't undone it yet. I mean, we're still in the green. We're still doing okay, but that's subject to change, and it's subject to, it's not myself or the health department that is doing it. It's all the individuals in town that does it, not myself. We can't be everywhere. And so it's really up to the individuals to do a good job, stay away, do not come to work ill, even mildly. It's easy to get a test, okay? So things of that nature are really important. So as a recap, state metrics are increasing rapidly, especially since they've gotten over 2% positivity. It's not a good direction. Our upswing continues. We're still in the green. Our positivity is still okay at around 1%. We could very well have a good week or a bad week. It really all depends on individuals. And also that data results. So, next week, if you see a lot of cases, it might be from what we've done. There's an incubation period to this, so it takes a little bit of while. So you're capturing the couple of weeks earlier. So, again, diligence. And there is some new state guidance that came out last week and that you need to follow. The other thing I'll mention is that with town meeting on Monday, our metrics are still in the green. The event, town meeting is socially distant, and if people are wearing their masks and they're socially distant, we know that doesn't generally cause cases. And a great example for that would be schools. If I hadn't mentioned previously, a good study was the state of Rhode Island that determined they have about 100,000 kids in-person school. They have about 50,000 remote. Of the 100,000 in, there's been about, and this is a couple weeks old, about 130 cases among the 100,000, and 350 cases among the 50,000 remote. So what does that tell you? That tells you that you're more likely, because that's a pretty good span of 7 weeks when I heard that social distancing in schools and the protocols in schools are effective in keeping COVID down. So they're getting it somewhere else. And since we're sort of doing the same thing, even greater separation at town meeting, it's reasonably to say that, town meeting is a safe place, in terms of, if we're wearing masks and we're socially distant, that the likelihood is a lot less than, let's say, other things that may be happening, or other places you may be going that same night. So it all, I've had a few people calling about town meeting. So we're still in the green. And again, that the social distance metrics work because we've been doing it every day in school. So every day the kids are wearing masks, they're socially distanced, and we're not seeing the transmission like you would see in sort of general population at general times that's not school specific. And so that's sort of where we're at with that. So that's my update for the week. And everybody keep up the good fight. Thanks.